The cost of healthcare continues to be a really big issue in the state of Vermont, and today was the first of a series of ongoing Vermont hospital budget hearings for the upcoming fiscal year.
With financial strains and an increase in medical costs statewide, we're learning more about what hospitals are dealing with and asking for.
NBC5's James Maloney tuned into the hearing today. He's live now in the newsroom with the latest on these talks. James.
Yeah, well, Brian and Liz, the chair of the Green Mountain Care Board, which sets the guidelines and approves these budgets, says hospitals are asking for more money compared to last year, with less increase requests as the state continues to focus on affordability challenges.
This is the lowest operating expense we've seen since 2019.
Vermont healthcare officials meeting virtually with the Green Mountain Care Board to present their budgets for the 2026 fiscal year. It comes as the state works with large financial challenges, including moving away from commercial health insurers like Blue Cross Blue Shield. GMCB Chair Owen Foster says the hearings will show a deep need for change.
My expectation is that overall this process will reveal or emphasize perhaps the serious need for system-wide transformation. The hospitals, some of them have negative margins in their budgets, and we know that there aren't additional healthcare dollars to support the hospitals at this time.
On Tuesday, the board heard from 2 rural hospitals, including Mount Ascutney Hospital in Windsor. It's one of the many hospitals that have dealt with reductions in service and providers, but they're still trying to pursue capital improvements such as eye care.
Again, one of the things that we've seen from this community is in Windsor is a lot of people have to travel out for basic eye care, and they have to go to a higher expensive place for care when they can do it here.
On Wednesday, the board is expected to hear from Central Vermont Medical Center and UVM Medical Center. Last week, the UVM Health Network announced it will cut 77 positions and will not fill 69 vacancies across its locations. The Health Network says the staffing cuts will save $5 million.
This is just part of a plan for us of how are we going to continue to maintain access for our patients and our communities.
But some hospital workers like Jordan Bushway with the Vermont Federation of Nurses and Health Professionals says the health network should have gone in a different avenue.
All of us are hard workers, and no one deserves to be cut or devalued as members of this hospital and the care that we provide our patients. I think it's important to know that, everybody goes to work every day to make a difference.
And the Green Mountain Care Board must establish a budget for 14 hospitals by September 15th with a written decision by October 1st. Live in the newsroom, James Maloney, NBC5 News.